Recording in progress.
Thank you very much, Petre. Let me begin by recognizing Mr. Stephen Price, Vice President and General Manager of CNW, and your team who are here with you or online. Mr. Hunter, Project Manager for the IDB project. Of course, our PR, one of our PR gurus in the Ministry of Health and Wellness and chairperson for these proceedings. I see other very important members of the ministry's team. I want to recognize you. Thank you for being here. And some other members who I don't recognize readily, except for a pin that's nicely positioned on their garments, which is suggesting that they are part of the CNW team. The masks, the identity. So forgive me if I can't call names, just why I'm not calling any name at all, just recognizing all concern. And online, I noticed that there are some persons, my understanding from my notes here, is that we have members of the Diplomatic Corps, France, Germany, Spain, and we have either Dr. Wayne Henry from PIOJ or a representative. And of course, they're members of the media and others. And I want to just welcome them. I also believe they are members of the Inter-American Development Bank or financing agency. And I want to recognize them because without their participation in this process, then this process clearly would be mute. It wouldn't make sense. This is a real momentous occasion for me as minister, and I believe for the public health space, the team, and indeed for the population, for Jamaica. As you know, we operate a system where public health interfaces almost with 99.99% of the population, even where you can afford it. If it's even to stabilize you until you are shipped out, you at some point in time come in contact with that public health system. And it is so important and in all our interests to invest the time, the effort, the concern, the interest, and the support to building out a resilient public health infrastructure. And 5+ years ago, when I became minister, we embarked on a journey which started with a dream, and we must dare to dream. To quote a phrase used by a more famous person. That dream led us to Washington, D.C., the head office of the Inter-American Development Bank, where meetings were held, follow-up meetings held in Jamaica. And, you know, as the saying goes, the rest is history. It went through several permutations and discussions and negotiations and approvals at the level of government, but presented at the end of it with a vision for public health that meant a transformation to build out a more resilient system, to build out a system that would seek to reduce transaction time and transaction cost, to improve and enhance customer care and service. The patients we serve every day, all 20,000+ of us in the system, to enhance the environment through infrastructure development, building out of hospitals, transaction time through diagnostic equipment. And in this instance, this was a very critical part of the system, was to build out a technology platform that would make a lot more efficiently the processing of patient information as part of the service delivery to improve the efficiency of the service delivery. And, you know, to put it frankly and simplistically, this idea of walking from one department to another to get information. And if you know anything about a hospital compound, even the smaller ones, you have to wear good walking shoes because it's not a small place. Or as opposed to downloading that information on a desktop, laptop, or the most important intelligent device that we have in the world, or cell phones. So we can quickly diagnose and quickly respond to concerns or to treatment of our patients, or to walk to the more often than not anyway, dusty room in a hospital or health center setting called the records room, where those thousands of files are stored. Sometimes I feel sorry for the people who work in there because they have to keep searching for these files. More often than not, they find them because they do a good job, but sometimes they get lost and misplaced. And so you depend on that for the history of the patient and how to continue treatment and so on, as opposed to going on your system in your office and just bringing up that history of treatment and care, responding quickly, getting them out of the door, getting them better quickly. I'm referencing these realistic examples because I want the country and the people of Jamaica and the internal and external stakeholders, and indeed our partner in CNW, to understand and appreciate, to the extent that I am sure they do, but even more so, how important this initiative is. This is game changing. This has the capacity to heighten customer service, heighten the delivery of that service, heal more people in shorter space of time, and so have greater throughput into the system, which will reduce, hopefully, the long waits that are characteristic of our public health infrastructure over so many years. So that's a vision. And where we are now is that we are now at the implementation phase of that vision. Took us a long time. I mean, Stephen, unlike the private sector, government don't work that fast, right? The bureaucracy associated with decision making, in the interest of transparency and accountability and all the other things that are necessary for taxpayers to be satisfied, oftentimes leads to significant process time, to the point where we can get some tangible results on the ground. And we have traveled a journey. But I do believe that this ICT infrastructure project, as part of the health system strengthening program, which is a title of this IDB GOJ partnership, which we intend to make a fundamental shift in what we offer, is timely, is appropriate, and I dare say, in light of COVID, it was a time that has come, and even before COVID, we anticipated that this would be necessary. The value of this project is $8.43 million US dollars, not Jamaican dollars, right? Put the US in front, make a big difference, right? That's well over $1 billion. And the project is intended to look at storage. This is the hardware side, servers, backup, disaster recovery, as well as network and workstations, cybersecurity, and help desk support. And it's not an infrastructure setup that is going to be in 2 or 3 facilities. I dare say, which is significant, it's going to be located and networking 150 facilities. I think we deserve a round of applause for that. What do you think? All of us that is in, right? Because the team has done a lot of work to develop the program. But 150 health centers will benefit, and our hospitals. So it's a process. We're going in phases, but this is sufficiently significant to make a difference, to have an impact, to demonstrate a pivoting for the better of the policies and the programs that we have to implement. As I said earlier, it's timely in light of COVID, because COVID has taught us one thing, if nothing else, that healthcare post-COVID can't be healthcare pre-COVID. if there's nothing that comes out of the COVID experience, it is that we have to take out of the crisis the lessons that COVID has taught us in terms of our capacity to respond to a threat that disrupts our society in almost every single area. You know, in the past, some people felt that you could place in a silo healthcare provision and everything else can function because health is not as important except the individual personal experience, which you either have it or you don't, or you have to wait for it. I think COVID had said to us and is saying to us, and those who have eyes to see will see and ears to hear will hear, that every aspect of life, economic aspect, social aspect, socioeconomic aspect, is impacted by a health threat. And COVID came suddenly and has wreaked havoc on our society and has changed life as we know it, at least for the past year and a half. You know, lockdowns and restrictions and work from home and overcrowded hospitals and oxygen run out and death and despair and mental health issues. We have to now engage almost in a process of recalibrating how healthcare is, in the first instance, perceived. Because if we don't recognize as individuals, and then from the bottom up to policymakers, that we have a vested interest in preserving good health systems, from prevention through to cure, then we have a problem as policymakers implementing it. So we have to start with that. And what COVID has also and should also teach us is that we have to adjust our thinking in terms of how we manifest that in terms of what we offer. And it is a little bit of luck, but a lot of, I think, vision and foresight. And I'm not claiming credit for it. I think the government of the day made commitments when it sought political office, and we sought to live through to that. So it is collective, and the people in their wisdom supported that vision. That's the nature of our democracy. But it is good that we actually started on this journey before we are where we are. So we, in a sense, have an advantage. I must view what is happening here today almost as a head start. And we must take advantage of it, utilize it, and give it our best opportunity to work for the benefit of all of us. Not some of us, all of us, those who are going to be served and those who are providing the service. Now, it's interesting that COVID would have done this to us, but I'm happy it has. And from that standpoint, that's the potentially positive part of COVID. There are many negatives, potentially positive part. But the truth also is that that vision is and has been borne out of other critical statistics and data that we have. In that pre-COVID, we had an epidemic that we paid a little bit of attention to. Nearly not enough attention. It's an epidemic of lifestyle diseases. We call it NCDs, non-communicable diseases. I'm looking at some stats here, 53%, this is WHO stats, of 155 countries. Well, before I get there, 70% of our Jamaican people die from a lifestyle disease. 1 in 3 are hypertensive, 1 in 8 diabetic, 4 out of 10 unaware of their status, 1 in 2 are obese or overweight, that's 50%. And all of that leads to 7.5 times out of 10 when we meet our demise, 18,000 or so deaths each year. It's because of how we live, how we interact with our environment, our consumption habits, lack of physical activity, and so on. And that is an expensive prospect as it relates to healthcare and the responsiveness that is required. It has taken a lot out of us, and it's almost a never-ending cost. And it's a trend that we have to deal with. So part of this project is to help us to assess quickly the trends in the environment to provide the treatment that is required, and of course, to manage the chronic care model that we have instituted and are instituting that will see us addressing concerns at all levels of the society, from primary health care, meaning the health centers in the communities, prevention, looking at a person's history, that's how it manifests itself. If you have a little bit too much sweetness in your blood, you are told that cut back on the salt or cut back on the sugar. If you like to go to the bar every evening and drink a little spirit, and it starts to give you a little hypertension, your doctor can see the history of that based on your blood pressure checks. So we're hoping that the manifestation of this system will also help us in prevention by reading into trends quickly and accurately and providing the appropriate advice as we go along. So today we say thanks to the completion of this phase of the project, meaning the signing. We want to commend the contractors who have been awarded through competitive process, tendering process. Cable and Wireless has a rich history, clearly. You have evolved over time. You are well networked. You know the technology business, and therefore we don't expect any ambiguity or misunderstandings as it relates to what your role is. What I would certainly challenge you on is, and this is an important challenge, is that you deviate from the unfortunate general tendency where we tend to have contracts that go longer than they are supposed to. So cost overruns and time overruns. I'm sure you have the capacity to do that because you report to shareholders, right? And if you do that in your normal course, then they will pull you up for it. Where there are issues, we want to work to ensure that those issues can be resolved quickly. And I'm always available to the extent that I'm in the position I occupy. I believe the administrators and the team are always there. It's going to require management of the process. And I want to just encourage you to let us get going on it and do it as quickly as possible. I think we have an opportunity now because people are willing to invest and to engage. The final point I want to raise before I sit is that the challenge with the implementation of a project of this kind, technology-based project, is the extent to which, and I've said it to Mr. Hunter as the project manager, to which you get the people that are users of the system engaged sufficiently to transition to the new way of thinking and new way of operating. So change management is a very fundamental part of radical shifts in approaches. And in a sense, we're really transforming or attempting to transform the way we deliver healthcare by putting in the infrastructure, which will only manifest itself into benefits if it is used by the people. And, my little reading of history on these issues, which I try to keep up to date, is that if we don't have a strong change management variable or component, you put in the best systems ever, and people pass it and just get on it after a while, because the doctor that used to holding up the film under the light with the X-ray, even though him get it on him phone now to use it, him still hold up the film under the light because that him used to. And him intimidated by the technology. The nurse or the administrator who used to write up the paper-based stuff find it difficult now to go online and to type in and so on. And one of the things that we're going to have to do to really optimize the return on these investments is to embed in the process from start to finish the change management. We can't wait until the project ends. We have to, you almost have to show people how it is done and why it is being done the way it is being done from the start. And one of the things I've said to my internal guys is that you have to work with the provider of the service, the contractor, you guys, and it almost has to be a teaching moment, even while you transform. And I want to find opportunities in the process as we go along to provide that teaching moment to those people who ultimately are going to be overseers of the process and users of the process. So I don't know if that is written in the contract, but if it's not, I believe for the benefit of all of us, we should find a way to tweak the implementation to accommodate that as best as possible so that we can move quickly to usage, which is where you will see your best return, not just in the dollars and cents, but in the, according to Maslow's hierarchy, the actualization, self-actualization, our firm actualization. So I really want to commend that. So thanks again. This is again a very important development. It is being accompanied by other developments. We are now doing designs for the build out of a number of hospitals and health centers. So that infrastructure component is on its way. We're going to be buying out, investing in diagnostic equipment. We're going to be training more people. And I really believe that, the legacy that we're a part of is a special legacy. And we must put our best foot forward there, because not only might it save our lives one day, who knows, it certainly will have an impact on the entire population. And as we have seen with COVID, public health is essential to every other health, whether the profit health or the other health of our population. Thank you very much.
Thank you so much, Minister, for what was an insightful presentation. Again, a couple of critical cues coming out of that for us. The road to our place of progress today has been a little bit bumpy in parts, but we are here at this place of progress, and it could perhaps not have come at a better time. Minister has said that healthcare before COVID is certainly not healthcare post-COVID, but clearly the Ministry of Health is positioning itself to ensure that all of the emergent needs we are able to appropriately, through collaboration with stakeholders like CNW Business Jamaica, meet the needs of persons utilizing the public health system. It is that point now in our program where we ink the deal. And so I wanted us to invite Ms. Frith, our procurement specialist, to support the gentleman here. I wondered also if the ladies, a couple of the ladies from CNW Business could join us, please. Use this chair. Yes, please. Yeah. Yes. All right. No problem. So, there's another critical person. I'm sorry. This subaltern. We can't. You're ICT. Come, sir. Come. Yes. Thank you very much. You're most welcome, Ms. Frith. Yes. Yes. We can do one without the mask, and then we can all don the mask. So one with, and then one without. With first, yes. The with, yes. Yes, when you're wearing the mask, you can be a little bit tighter, and then once you, then we'll separate them. One side. Yes. Yes, please. With a little bit more spacing between us so that we're not putting anybody at risk. Yeah. All right.
Great. Thank you very much.
Mhm.
Appreciate it.
Start to finish.
Of course, Mhm. Oh dear, we don't want it.
All right, you got it?
Yes.
All right, ready? Almost last one.
All right, thank you so much, ladies and gentlemen. At this point, we're not quite done. We're getting there, but we're not quite done. I wanted to just pause to see whether or not our members of the media who are online or inside the room had any questions that they would want to ask. And we invite them, if they do, to utilize the raised hand feature. Any raised hands, Mr. Jones? No raised hands? Okay. Going once, going twice. Excellent, and we're gone. That's how good the presentations were. All right, I now invite Mr. Hunter, our project manager, to give the vote of thanks.
Ladies and gentlemen, in person and online, good afternoon. The popular Chinese proverb says the best time to plant a tree was 20 years ago. Minister spoke about this thing taking a long journey. We should have done it many years ago, but we are here where we are now. And as the Chinese proverb continues, the second best time is now. Our MC noted at the start of these proceedings that today was a good day for public health. I think we can all agree that this is so. There are many activities that would benefit Jamaicans, myself, family members, etc. I am therefore honored as a project manager and as a Jamaican to propose the vote of thanks to all who have made today possible. First, I want to thank and extend our gratitude to the Honorable Minister for taking time out of what we know has been a very busy schedule for the last year and a half, especially now, to be here today and for the delivery of an insightful presentation, reflecting the tremendous progress of the Health System Strengthening Program, for which she has provided invaluable vision and leadership. Also, our gratitude to Mr. Price and his team for taking the time to be present here today, and importantly, for the clear commitment to ensure efficiency, sustainability of the improvements to the ministry's ICT infrastructure. To the hardworking project team, Mrs. Fritz, Mr. Bolton, Mr. Maraj, and others, Mrs. Suarez here, and the entire team at the Ministry of Health and Wellness who work tirelessly to boost the capacity of the public health system. for us to deliver the highest possible quality of care, including today's important milestone. You too have our thanks. We're indeed grateful to every person in whatever way, small or large, who helped to make today's event possible. I thank you all for your contributions and continued cooperation to work in the public health interest. Thank you.
All right, so that's a wrap, ladies and gentlemen. Thank you. Feel free to partake of the refreshments that we have at the back. Have a great rest of the day.